system for real-time tracking and for last-mile distribution. Now we have a turnaround of about 7 days, and national buffer stock is maintained, Honorable Speaker and members, to cushion against any delay in case of any disruption in the global supply chain. Lastly is our procurement strategy. Honorable Speaker and members, up to 70% of the treatment commodities for drug-sensitive TB are procured using GOK funding, which will help us to enhance sustainability and reduce reliance on external sources. So on TB, we have 70% to make sure that none of our citizens miss out on these important drugs. The last one, Honorable Speaker, was to state the efforts in place to preserve and build upon the progress previously achieved in the fight against tuberculosis through USAID funding. Honorable Speaker, we have initiated a deliberate measure to safeguard and scale the gains achieved through USAID support and aligning them with the national UHC agenda. We have done health system integration. TB services now are being integrated into primary health care and UHC framework to ensure sustainability and reduce dependence on vertical programs. So Kenyans now can visit their level 2, level 3, their dispensaries, their health centers to access these TB services. We're also building the capacity continuously, training of our community health promoters. We are training our clinicians and lab staff in order to maintain a thorough on-the-job mentorship, and government supports these fresher training programs. And lastly, we do domestic financing advocacy. We continue as a ministry to advocate for increased domestic financing at both national and county level. The annual TB budget for the financial year, Honorable Speaker, 2024-2025 was $136 million, of which government funding covered only 1% and donor funding 20%, leaving a 79% funding gap. We will appeal to the House, the National Assembly, which is a budget-making house, for increased resource allocation. But, Mr. Speaker, I don't want to say much, but we are talking to our colleagues under the new U.S. administration, and we are coming up with a substitute for USAID. And I think by the end of this month, the country will hear the good news. That we might not call it USAID, we might call it something else, but we are negotiating, and by the end of this month or early next month, we will find a way of how we can bring back the role USAID played, because USAID was key in this area. And then, of course, we are collaborating at the multi-sectoral level to make sure that there's accountability. And so sectors like housing, nutrition, correctional services, and labor, we are also telling them how to address the social determinants of TB. Thank you, Honorable Speaker. But just to finish, we will, through Honorable Gitau, and we will write to the House, we will ask for more allocations. But rest be assured that TB control will closely linked to poverty, it's closely linked to poor housing, it's closely linked to poor nutrition, and that's why we have to adopt a multi-sectoral approach and talk to other stakeholders for accountability framework. Thank you, Mr. Speaker.
Faith Gitau, you're satisfied?
Thank you, Honorable Speaker. I want to confirm to the Minister that we have no TB drugs in Nyandarua, and most of the hospitals around, in Kenya, do not have these drugs. Please, you have said that you're providing free of charge. When do we expect these drugs in our hospitals?
Minister.
Honorable Speaker, I was in Nyandarua 3 weeks ago. I want to confirm to the House there are plenty of TB drugs in Nyandarua. And I am ready to send my officers to Nyandarua with the honorable member to go and verify. I am ready, Honorable Speaker. I cannot lie to this House. The TB drugs are available in Nyandarua County, in all the hospitals, and I'm ready, under your direction, that the Director General of Health, approved by this House, is here. I will dispatch him to Nyandarua tomorrow and to confirm to the honorable member.
Fair enough. Kagusha?
Thank you, Honorable Speaker. Could the Cabinet Secretary in charge of health clarify whether there is an outstanding debt amounting to Kenya shillings 450 million shillings owed to Consolata Hospital, Mathari, and of course 433 million to Nyeri County hospitals, including 36.7 million for Mukurweini Hospital and 236 million for Tumutumu hospitals.
That is
and this comprising
Kagusha, that's not your question. You are not allowed to go beyond what is on the order paper. So just read out your question. You can ask those other figures in your supplementary.
Thank you, Honorable Speaker. And this amount comprising of arrears accumulated at the National Hospital Insurance Fund and payments for the Social Health Authority, that is NHIF and SHA. Number two, state the factors contributing to the prolonged delay in remitting payments to Consolata Hospital Mathari, despite the provision of health services to patients. Of course, Honorable Speaker, I would like just to note that the fraudulent payments in millions have also been made to dysgenious hospitals, while genuine ones are missing out. Honorable Speaker, number three, outline the measures put in place to ensure the debt owed to the hospital is promptly settled and its operations fully restored. Number four, provide a timeline for the payment of the arrears and dues accumulated from October 2024 to April 2025 to Consolata Hospital, Mathari, by SHA. Thank you, Honorable Speaker.
Minister.
Honorable Speaker, on Consolata Hospital, Mathari, I first want to clarify that the NHIF legacy debt, and that is one of the problems, biggest problem that we are facing as a country, and which is making the implementation of the Social Health Authority a bit bumpy, because many of the questions that are raised on debt are on the legacy debt of NHIF. As of 30th September 2024, when this House enacted the new Social Health Authority Act, the NHIF liability owed to Consolata Mathari Hospital stood at 153 million. This facility falls under the category of health providers owed amount exceeding 10 million shillings and is subject to verification and validation process as mandated both by law, by the Constitution, by the PFM Act, and by the presidential directive prior to any payment being made. So, Honorable Speaker, and I've attached the letter that Kenyans who are owed between 1 shilling to 10 million of the former NHIF debt, amounting to 5.3 billion, accounting for 92-93%, will be settled. And I've written to the Minister for National Treasury, and I'll table the letter, that he puts it in the supplementary estimates. And currently, Honorable Speaker, using the audit, pending verification audit led by the former Auditor General and the leadership of Social Health Authority, we are auditing and we are verifying and validating all the pending bills of NHIF. On SHA payment status for Consolata and outstanding payment, the overall SHA settlement rate for all our faith-based organization facilities whose their bills and invoices and claims have been verified, reviewed, clinically checked, and are ready for payment and paid is standing at 65% as of today. Consolata Hospital Mathari will receive 29,324,966.47 for claims which are currently being processed by SHA. They have been validated, they have been reviewed, and they have been confirmed that they are the right claims, and they will be paid in the next payment cycle, which is the 14th of November next week. Honorable Speaker, I have also provided a table summarizing the payment status of Consolata Hospital Mathari. And this is a document. Since SHA started, Honorable Speaker, over 372 million have been paid to Consolata Hospital Mathari. And that constitutes about 17,432 claims. In October of this last month, we have received 4,792 claims, totaling 81 million. And they are the ones which are under review. Honorable Speaker, it's good to say it here on the floor. And the leadership of Consolata, we have told them, we have shared with them, they said with the claims managers at SHA, a total of 335 claims have been rejected with a money value of 14,799,325. And Honorable Speaker, if you allow me, what is a rejected claim? A rejected claims is number one, if that claim you have lodged and the patient was Honorable Duale, the Minister for Health, if that claim does not have a claim form, I am sure every member sitting in this house, when you go and see your doctor, there is a claim form that you sign. The first part of that claim form, it is the patient who signs your name, your address. The second part of that claim form is signed by the doctor attending to you. And the last part is signed by the hospital administrator. We have situations where, number one, there's no claim form. Number two, a claim form is written with one biro pen with the same handwriting. That claim is rejected, is fraudulent, and it will never be paid. So Consolata has a rejected claim of 335, totaling 14 million. We have returned claims totaling 15 million. 877, Honorable Speaker. What is return? When certain important documentation are missing. Invoice is not itemized, documents are missing. Those are not rejected. The law allows you to go back, bring those documents missing, and you don't need to bring them physically. You just need them to upload into a digital superhighway. Then sent for payment, which will pay by the 14th, is 29,324,966. Then they have got 127 million, a total of 2,800 claims, which now is under review, and our doctors, clinicians, the system is reviewing. Is everything in order? We don't want to pay unless we make sure. So in total, Consolata is not even the 450. It's 676,205,000, and I've given the order what is due, what is required for documentation, what has been sent for payment, and what is rejected, and what they need to provide. On the factors contributing, Honorable Speaker, to the prolonged delays in, some of them I have said, but let me say the problem with the Consolata, and I hope the Member of Parliament will go on, because we have told them ourselves, the complex claims. Consolata Mathari Hospital submits high-value complex claims for service such as surgery, oncology, dialysis. These high comprehensive medical claims, they require very comprehensive medical review as part of the claims adjudication in order to process to ensure adherence to established clinical, contractual, and financial compliance. They must be subjected to some audit. So if it's oncology, we must make sure the cancer patient was there. He has gone through all the systems. We have to check the ID card. We have to, if it is surgery, we must make sure there's theater notes and all the other, and all this is for compliance because of the contractual obligation, because of financial compliance, or because of standard before payment. And the claims under review are for the period 12th of August to 30th of October. Number two, with the Consolata, we are facing what we call provider submission issues. There's delays, which are largely occasioned by provider-based factors. If they take long to provide submission of documents, if there are missing signatures in those documents, if there are incorrect patient details, and if there are low resubmission rates for correction, then the social health authority will not be blamed. And we are telling all facilities, public, private, and faith-based, including our referral hospital, going forward, they must employ dedicated staff, managers, claim managers, who will make sure from morning to evening they are dealing with claims and reimbursement and work closely with our county and relationship managers for different categories. Honorable Speaker, the last question was, and then we had an issue of, we took long in terms of claims management, but I want to say that because of many litigation and court cases, at least now, SHA has since hired 9 case management officers, and recruitment is going on to build the capacity. The third question, Honorable Speaker, was to outline the measures to put in place to ensure the debt owed to hospitals. I think on the NHIF legacy debt, the claim of Consolata falls above the 10 million threshold, and we have subjected it to comprehensive verification and validation process mandated by the President and the Cabinet. But Honorable Speaker, let me now speak as a Kenyan. I think Parliament at some stage will come and talk to you. I think there are facilities, and they are both in public, private, and faith-based, that face imminent closure because of the NHIF legacy debt. I think we must do whatever it takes, and I will do it myself as the Minister for Health in consultation with the President and the Cabinet to make sure that we resolve this. Because once we resolve that, then I think a lot of the questions are on that legacy debt. On NHIF claim settlement, as I have said, we are reviewing our medical review capacity. We have done full automation of the claims processing using AI-driven in collaboration with the Digital Health Agency. And now we have a faster verification and timely payment. And we have enough money, Honorable Speaker, to pay our facilities. We are doing also stakeholder engagement. I led a meeting with all the bishops who run, and the different churches that run, and the SUPKEM who run faith-based. And we have agreed, we have created individual relationship managers. We have set a number of private sector players in Nairobi and the surrounding counties. When we do our rollout, SHA rollout, we also engage with the people. But I want to ask Honorable Member from Ukraine that even tomorrow we will engage with the Consolata Madari Hospital so that we reconcile our accounts, because they provide very important facilities. But Honorable Speaker, if you allow me, I had 2 weeks ago, I had met in Rumuruti the CEO of Tumutumu, the CEO of Chogoria, and the CEO of Kikuyu Eye Hospital, and they sat with our team led by Dr. Mercy. They have reconciled the claim submitted by Tumutumu is 276 million. Payment completed is about 137 million. In October payout, they received 14 million. We have a rejection of 21 million for Tumutumu, and we have under review close to about 103. So we are engaging them, and all our PCA hospitals, we are talking to the Secretary General. So on a daily basis, we had the Deputy Secretary General of PCA, and on that occasion, I'm the one, Honorable Karani, Dr. Karani was there. I'm the one who asked, please come with the big hospitals, and we did, and we have reconciled.
Sure.
Thank you very much, Honorable Speaker. May I start by thanking the Cabinet Secretary for having given me students for Mukurweini KMTC. The students have now reported, and they have started learning. And actually, they started learning today. And for that reason, Honorable CS, I want to very sincerely thank you very much on behalf of the people of Mukurweini. Honorable Speaker, it is indeed true what the Cabinet Secretary has raised, that Mathari Hospital and Tumutumu Hospital and other faith-based hospitals in Nyeri County faces imminent closure, especially because of what he has called the legacy debt owed by the NHIF. And of course, we also have other private providers in Nyeri County and other counties that have that challenge. Honorable Speaker, the issue of Mathari Hospital having claims which are high value, which are quite sophisticated and complicated, is not a surprise, because this hospital offers very good machinery which is advanced and which also is quite sophisticated. And for that reason, there is need to get a working formula with this hospital so that they do not get unnecessary delays in terms of their refunds. Honorable Speaker, one of the issues that is being raised by quite a number of doctors, and I had a chat with a doctor by the name Goody Gol from Nyeri County. One of the issues they are raising is some of the requirements by SHA, which are raising ethical and legal issues. When, for example, Honorable Speaker, SHA requires you to provide written notes after every surgery by the doctors. One of the issues which is coming out that this information is quite sensitive, and if this information has to be passed through the what the CS calls the information superhighway, sometimes it's also considered to be an insecure information system. And you can imagine what kind of damage this information would do to the patients if it lands in the wrong hands or if it gets out there in the public. And of course, Honorable Speaker, this also is seen to be against our Data Protection Act. And I think the ministry, SHA and the ministry will actually need to come up with this, to come up with a way of handling this information. The last issue, Honorable Speaker, is that in Mathari Hospital, which is handling a lot of oncology issues, they are also missing coverage for a number of cancer treatment and diagnosis procedures, like the biopsies, histopathology, immunohistochemistry, cancer staging CT scans, which are very important in diagnosis of cancer, and of course, which are also pretty expensive. Some of them go up to 40,000 and above. So, Honorable Speaker, this is an issue maybe that we also need to be addressed. Lastly, Honorable Speaker, very lastly, I can see the Honorable Chair for the Health Committee is also here. Honorable Speaker, you remember I raised a question here and a statement request on the issue of blood transfusion reagents and blood bags in the country. Honorable Speaker, now it is well over 7 months or 8 months since I raised this question in this House, and the chairman has not responded even after approaching him privately, personally, severally. Honorable Speaker, maybe you need to prevail upon the chairman of the committee to respond to this very important question, especially now because the CS says that the US is returning their funds, even though through a different name other than USAID. Thank you very much, Honorable Speaker.
Leave the chairman out for now. Chairman, prepare and bring a response next week. Minister?
Mr. Speaker, the Social Health Authority was enacted by this House, and it aligns to the data protection. The same with the Digital Health Agency. And if member from Ukraine, and thank you, you came to my office, I am happy I have complied on the MTC issue. And that's why I want to tell you, this is a government that delivers. When leaders come, despite their political orientation, we serve the people of Kenya. But SHA complies with the Data Protection Act mechanism in place. 2, patient consent is also availed. But let me bring to the attention of this House, Honorable Speaker, that claim adjudication requires verification that the service took place. The doctors who are talking to you, and I'm sure they're watching me, one of the basic, I'm not a doctor, but I sit with the doctors every day in Afia House. And next to me is the Director General of Health, who this House has vetted and approved. And in Section 16 of the Health Act says he is a technical advisor to the minister and government, including parliament. In medical school, in theater, for Social Health Authority to confirm a procedure has taken place, that facility, that doctor must provide theater notes. Minus theater notes, that claim is rejected. I'll give you another more simple example. If a delivery, a maternity delivery has taken place in a facility, whether through C-section or normal delivery, and you want Social Health Authority to pay, part of the claims document, there must be a very important document known as birth notification. If there is no birth notification, then how can SHA pay you and prove that a child has been born? You know, Honorable Speaker and members, we should not compare the Social Health Authority to the defunct, corrupt, with no system NHIF. They are world and world apart. It's like first world to third world. It's like day and night. So the people who used to be paid millions of shillings for birth or maternity without providing birth notification, that will not happen anymore. Without, even Honorable Speaker, now for a doctor to use his authorization, pre-authorization, OTP, he must be within 500 meters of the health facility. There were days when doctors and healthcare workers could could use their OTP to authorize from their bedroom at midnight. We want doctors, when they want to use their pre-authorization code, we want them, and healthcare workers, we want them to go and visit and do it in the health facility, meet the patient, see the condition of the patient. Never again will theaters and health facilities be run using the mobile phone of healthcare workers. Honorable Chair, I don't want to go into the blood services. I have done the answer. The chairman, my chairman, is very capable and competent, and I'm sure when the time comes, he will provide the answer.
Kazi Mtandaza.
Thank you, Honorable Speaker. I rise to ask question 74 of 2025 to the Cabinet Secretary. Could the Cabinet Secretary, 1, provide a report of payments made by the Social Health Insurance Fund, including the number of vulnerable people catered for by chief in Matuga constituency and nationally. 2, state the timelines which the Social Health Authority, SHA, will reconcile payments made under NHIF through the NGCDF that were not transferred to chief and indicate the fate of these payments. 3, outline measures implemented to cover the patients who are unable to pay their balances after exhausting their chief cover. And 4, state the plans put in place to clear balances of patients detained in public hospitals due to their pending hospital bills balances after exhaustion of their chief cover. Thank you, Honorable Speaker.
Minister.
Honorable Speaker and members, on the vulnerable persons, the national government is currently responsible households, translating to about 1.5 million Kenyans who their data was picked from the social protection net across all constituencies and divisions and wards in our country. Of this number, 1,769 households were from Matuga. So the 558,000 indigents that we launched at the national level, we have confirmed and we can provide the list. 1,769 households are from Matuga constituency. And these members are now active and can access all available SHA benefits and paid for by the government of Kenya under the able leadership of President Ruto. Additionally, over 62,461 households are sponsored by counties, the NGCDF in our various constituencies, and various development partners and philanthropists. Question 2 was to state the timeline. Honorable Speaker and honorable members, SHA recognizes that some sponsors, including NGCDF, have had made prepayments under the former NHIF that need to be transitioned to the new Social Health Authority. I really want to ask the indulgence because we didn't have staff, we were recruiting, there were many court cases, but now serious reconciliation of these transitional prepayments made by members of this House to the defunct NHIF, such as those from Matuga, are currently ongoing, and I have directed the leadership and the board of SHA that they must conclude it before Parliament goes on for the long recess, so that members can now identify and use these resources for the indigent among their constituencies. And then SHA has also committed to finalize this transition of these balances, and they will credit them to the members' SHA accounts as soon as possible. We will also, Honorable Speaker and members, provide a comprehensive update on such payment once the reconciliation is complete before the House goes on recess for all affected counties and entities. And these prepaid balances will be credited into their accounts. Number 3 and 4, Honorable Speaker, combined was the measures implemented. Honorable Speaker, the Ministry of Health acknowledged the concern regarding patients reportedly detained in public hospitals due to unpaid bills following the exhaustion of their chief cover. What measures are we doing for this, to give these Kenyans financial protection? And before I give these measures, Honorable Speaker, SHA will not pay everything. We are only now dealing with oncology. We want to make sure we increase the package for oncology, and that because cancer is a serious disease in our country, that we protect the most vulnerable cancer patients. But if you go to use your chief card, then you must be ready to pay a balance that will be left after. But we want to expand the benefit package, and this includes the emergency chronic critical illness fund. We want them to cover the very critical and the very prolonged care after you exhaust your shift limits or your shift limits are reached. Then, like cancer, oncology, if the member exhausts, then we will now, CCIF kicks in, that was found. On another financial protection, we want to look at how we can strengthen mechanism for financial protection, especially for indigents and vulnerable population, through our social health subsidy program. And this subsidy program will be targeting the most vulnerable people of our society. So we will continue to work closely as a ministry with the SHA and our county governments to ensure that financial hardship does not deny citizen access to essential healthcare service. And this is the philosophy behind universal health coverage. Thank you, Honorable Speaker.
Yes, Tandaza.
Thank you, Honorable Speaker. Let me start by saying that I'm half happy, given the statement that they are working on the vulnerable people in Matuga. And he has said, before we go for recess, he'll have completed that process. I'm half happy because I highly doubt if that will be done, considering that when we made the ministry last time, I think in Naivasha, during our retreat, that time we were given as parliament that in 4 weeks, that process would have been done. And that, I think, in February. Now we are in November, but the CS says before we go for recess, that means in 2 weeks' time or thereabout, that will be completed. I would want that to be noted and actually see if it will actually happen. If it happens, I'll be full happy. 2, there is a communication which I think should be very clear, CS, through the chair. The information out there is that once you are fully covered by SHA or SHIF, all medical expenses are taken care of. And I think that's what brings the problem of people saying SHA doesn't work, because now the CS is saying it's not designed to cater for everything. I think this information should be very clear, because all the communication that we get from the executive is that once you are covered, go to any hospital, walk in, be treated, and go back home. But here the CS has said it does not cover everything. Can that also be clear and be communicated so that we know the limits of SHA? Thank you, Honorable Speaker.
Minister.
Mr. Speaker and honorable members, I want to make it very clear, and it's even very clear in the laws that this House has passed. What is paid by the exchequer and is free to all Kenyans, as long as they are registered with the Social Health Authority, is the primary health care in level 2, level 3, and some parts of level 4. That one is very clear. The President has made pronouncements. The Honorable Speaker has made those pronouncements. And we should not confuse Kenyans. And that's why 9.8 billion has been paid out. Reimbursement for primary health care facilities, both in public, private, and faith-based. Outpatient. You walk in, you walk out. And Honorable Speaker, the governor of Nairobi is one governor I want to thank. In his primary health care facilities, level 2, level 3, and part of sub-county, he has made it put clear, even posters, saying, walk in, walk out. So that, but we have, in some instance, where some counties are co-charging. It's called co-paying. And even the committee of this House have gone out and they have found out. And we have said that it's criminal, it is not right. Now we come to SHIF, the Social Health Insurance Fund, where you pay, if you are in the formal sector, salaried people, 2.7% of your income. And if you are in the informal sector, you go through a mean testing and you pay based on what the mean testing tells you, based on your assets. That one, the Social Health Insurance Fund, is not free. You must pay for it. And that's why if it's maternity, normal delivery, 10,000, fully covered. But there are certain specialized. if you overstay in the hospital, maybe the bill is about $1 million, chief will pay 700, 600, the balance must be paid by the patient. Honorable Speaker, I want to confirm, when members were being given that commitment in Naivasha, I was not the minister. But I want to confirm, and I know, Honorable Speaker, when you go on record, I was not...
Mr. Speaker, the Honorable Cabinet Secretary has kept on telling us that in some instances, the SHA will pay and it will leave some money for the patient to pay. Is the minister aware? Is the minister aware that the Constitution guarantees Kenyans health services? Because there are some Kenyans who are very poor, and they don't choose which type of sickness that will befall them. Any type of sickness, whether expensive or not expensive, may befall them, and they will overstay in the hospital because of those sicknesses, or it may exhaust their contribution. Why can't the government say where it's exhausted, they pay for the patient, because it's not his wish and he has no money?
Yes, Bayer.
Thank you, Honorable Speaker. I think the Honorable Cabinet Secretary has been very clear on Chief, SHA, and the other one. And I think the Honorable
Which is the other one?
The Honorable Wanjala needs to be awake and listen to Chief or SHA, the one that pays and the one that you don't pay. Those are two different things. So I think Honorable is probably to say Chief does this and SHA does this, so that the Honorable Wanjala understands clearly.
Naisula. Order.
You are not qualified to answer.
Naisula.
Wanjala, your noise maker. Honorable Speaker, I had the Cabinet Secretary clearly giving credit to the governor of Nairobi, but then he said there are some counties which are co-charging. It is in the same breath that those counties should be named in this house, because for the same stick you give credit, we need to punish, and those counties have to be ashamed and they have to be named, and those governors should be surcharged and should be jailed for co-charging the patients, Mr. Speaker. They need to be named.
Yes, Jalango.
Thank you so much, Mr. Speaker, and thank you so much, Cabinet Secretary. The one thing that does not come out very well is to what level is SHA or SHIF taken care of. We have situations, and I had a public participation just the other day, where we have patients who SHA have covered large amounts, and those that have been covered in very small amounts. So they keep on wondering. This guy was paid, the patient was paid, bill was paid to an extent of 300,000. There's this one who is requesting only 15,000. It is not being paid. So there's one thing that the Cabinet Secretary and his team must come out and tell the public. Continuous communication about what is covered by what to what extent. And lastly, Mr. Speaker, during this public participation that we had with our people, there are those who still want even to be told to be taken through on how to register, and they want to register, they still don't know how. And your medium of communication cannot rely on TV and newspapers only. Nowadays we have so much. You're even talking about AI being used now in the medical space. We have these influencers. We have these social media spaces that we need to have this communication go out again and again so that we demystify this thing about SHA. It is working, yes, but you get to a point where you still have to explain to people, Mr. Speaker. Cabinet.
Speaker, you made your point.
The Cabinet Secretary needs to come out, as my colleagues have said, very clear on what SHA covers and what SHA does not cover. And I want to go on record, Honorable Speaker, my own mother my own mother stayed in hospital for 5 days, and SHA, out of her bill 213,272, SHA only paid 11,740. Honorable Speaker, Cabinet Secretary, what's not happening? Surely something is not being truthful. We are not telling the Kenyans the truth on what SHA can and what SHA cannot do. NHI probably used to pay better than this. We just need that comfort. Communicate very clearly, and the evidence is here. Hospital bill is here.
Kibagandi.
Thank you, Honorable Speaker. First, I would like to be very clear that the CS is talking about an ideal situation. That is not what is happening on the ground. Just like Honorable Oundo, my mom has been sick for close to 10 years now. In 2019, she was operated on. It is called diabetic foot. And the bill then came to about 625,000. NHIF paid 270 or thereabout. On Saturday, the bill for my mom, who has been ailing again and had to undergo 2 operations at Metropolitan Hospital in Buruburu because of diabetes, the bill came to 1.1 million shillings, and the bill that was paid by SHA is 123,000 shillings. I shared that with my chairman, and we shared that with the hospital. And Honorable Speaker, today I'm trying to control myself so that I don't demonstrate the unfortunate thing that happened the other day. What I would like to assure you, Honorable Speaker, is that nobody in this country has done research on SHA like I have. Number one, on issues to do with benefits. The benefits in SHA are inferior to what NHIF was offering. That is one. Number two, the processes of reimbursing hospitals is systematically oppressive to hospitals, in the sense that hospitals now are too careful on how they handle patients. Number three, professionalism within the ministry, SHA, and every other space within the Ministry of Health, Honorable Speaker, we have trouble. And this is happening, including up to the counties. And at this point, Honorable Speaker, I would like to request the Honorable Cabinet Secretary, when people raise concerns, please don't politicize these concerns. Seek to have proper interventions for these concerns. Thank you, Honorable Speaker.
Didymus.
Thank you, Mr. Speaker. I want the Minister to confirm 2 questions. Number one is during means testing that those Kenyans who are perceived to have some stable source of income will pay more than those who do not have, so that we can be able to understand why Kibagendi's mother, NHIF, paid more than what SHA is paying her. If that clarification is done, then we can understand that in terms of means testing, the amount you pay is dependent on your perceived income. Number two, can the Minister confirm to this House, because any new policy that the government implements must either generate into some small public problems, because it is new. You may think you are solving one, then 3 or 4 comes up. So can the Minister confirm to this House that in his ministry, he has set up a team that will entail in collecting data, collecting those problems that are coming in implementing this SHA and SHIF, and that they are working around the clock to ensure that those problems don't recur again, because policy improvements are done by using feedback as a tool for continuous improvement. Can the Minister confirm to this House that indeed Kenyans should be confident that SHA and SHIF will continue to improve because they are collecting data which they use as a tool for continuous improvement? I thank you, Chair. Yes.
Mama Dagoretti.
Thank you, Mr. Speaker. Mine is just to ask the CS whether the ministry has ever done what I'll say, just go and do your tour to different hospitals, sample out, and get to learn what is the biggest challenge that we are facing as a country. Because when you hear the prices we are paying in hospital, I'll give you an example. CS, I know SHA doesn't really cover so much on patients of diabetes. And we find a hospital, just the normal testing of diabetes, on the fee that they are charging is 700 per test when a patient is admitted in their hospitals. I will tell you today, I am discharging my mom. If I give you the figure we are paying for 1 week, 4 days, 3 million, doesn't make sense. Yusuf was here, the brother passed on 2 days ago. Stayed 4 weeks in Aga Khan, 11 million shillings. 200,000 was the dialysis test every time. We need now to come with a cap, and I want CS to look at it. Either you tell us the taxes on issues of health are so high that the hospitals should be charging this, or we bring a cap and we decide as a country, this is where a hospital can reach. If it is management, take a patient the way they do in the US to a management care hospice for Kenyans are going to go to the worst in this health system. Thank you.
Nabulindo.
Thank you, Mr. Speaker. Mine is very specific, and I would like to talk to Waziri. Waziri came to Mumias 2 months ago and had negotiations with our Bishop Kakamega, over St. Mary's Hospital, Mumias. And on that day, the CS announced publicly that St. Mary's Hospital is going to be opened the next day. Mr. Speaker, I would like to inform the House and the CS, if he's not aware, that St. Mary's Hospital is yet to be opened. The people who are getting services at St. Mary's are still suffering. And St. Mary's, this is an institution that was opened 1930. It has a lot of significance in Wangaland, and all of us have grown up using St. Mary's Hospital. In fact, several of my children have been born in St. Mary's Hospital, and another one will be born there next year if it will be open. So could the minister...
You are a very hard-working man.
Yes, I'm sure next year Mama will go there to get a baby. But the hospital is not open. So what will happen? So could Waziri tell us what is actually going on about St. Mary's Hospital? People are really suffering. Thank you, Mr. Speaker, and thank you for the chance.
Robert.
Thank you, Mr. Speaker. You know, NHIF had a very, very bad reputation, and due to its poor management of claims, and the CS has constantly made, mentioned that. But CS, when now you started deducting more money under the new arrangement of SHA, with a system that cost us 104 billion over a 10-year period, we thought that this issue of fake claims and this management of claims would be a thing of the past. Now, recently in a public baraza, you actually were saying that there's a lot of money stolen through the new system, and that you are actually going to take some cases to the DCI. I wanted to just know, does that mean that this new expensive system is not working? And so far, after you took your files to DCI, how many have been convicted and jailed? Thank you.
Honorable Speaker, let me start from the reverse. From my former colleague at Moi Forces Academy, many years, the deputy minority leader. Number one, the system does not cost 104 billion over a period of 10 years. And the government of Kenya is not paying a cent. because the 104 billion should have passed through this house. So what is there is a fee for service. The system is built, and the Kenyans who use through the Digital Health Agency, then the developers of the system will be paid. Two, and very important, that you have raised. In fact, the fraudulent claims and the facilities that were flagged off, number one, were flagged off by the AI system, fraud detection system of the digital superhighway, and then counter-checked by our clinical review team. As I said, Honorable Speaker, before I came to the ministry, and the SHA is just now 13 months old, the people who used to steal from NHIF went to SHA not knowing that this is a different animal. Honorable Speaker, you'll find a facility saying that there were 300 deliveries in their hospital, and all of them were C-section. That's even against the WHO rule. That is now a fraud. Or there are no birth certification. The system says, the system will check the documentation, or there is no even the legal document of the claim. So the system is the one that, and we submitted close to 118 files to the DCI with concrete evidence. I think up to about 20 plus he has submitted to the DPP. Once it has left me, it has gone to a different group called the criminal justice system. Some of them have been taken to court, very senior people in SHA, facility owners. And we will continue. And we have closed 184. I mean 1,184. And they are about, all of them, they're under investigation. So it is, and this fraud, same fraud is taking place in the medical insurance, private medical insurance scheme, even covered by Parliament. If you talk to Jubilee, if you talk to CIC, talk to them. The same problem SHA is facing is what they are facing. Because we had a meeting with them. In fact, today, if SHA suspends you from their portal, I can assure you 100% that facility, all other private medical insurers will also suspend. Honorable Speaker, there were a number of questions, and you know the first one, let me start with the Honorable Tandaza. I want to assure you that I have the list of all the NGCDF payments available. The list also contains receipts and dates and months. And Honorable Speaker, to be honest to the House, I will table that next Tuesday. I'll make sure the leader of majority tables. I kind of want to assure you, and just to give you a sample, Subukia constituency, between 2024 to 2025, the amount is 156,000. Jomvu, NGCDF, 9,960,000. Chuka Iganga Ngombe, 2,700,000. Mandera West, 3 million. Westlands, 966,000, among many others. And I'll table it to the House. And I stand by that. Before the House goes on recess, we will do all the reconciliation. It's now underway, and we'll post the reconciliation indigent list submitted during the NHIF time. We will submit to the House, and we will do it through mean testing, and we will make sure that we abide by the direction of colleague members. Honorable colleague members, from Honorable member for Budalangi, my good friend. In fact, between NHIF and the NSSF, I mean the NHIF and SHA, you should be a very happy member of Parliament, like me, as a minister. It's SHA that covers more than 4 women. You have 4 spouses. NHIF used to cover only 1. SHA covers unlimited number of children, as long as you can prove they are your children. So that alone tells you that NHIF and SHA, you can't compare the two. To me, Honorable Speaker, the package, the benefit package.
Yes, Angela, what is it?
I never asked how many wives does SHA cover. My question was...
Order, Angela. It is public notoriety that you have been proclaiming how many wives you have.
But I didn't say how many they should cover. He should answer my question. He should go back and answer my question.
Okay.
That nobody chooses which type of disease, the type of, whether expensive disease or cheap disease. So what we are saying is that SHA should cover everything once somebody is sick. Because it guarantees that.
Honorable Speaker, I have been with him for many years in this house. You can see, even when he's asking, he's a very happy man. So he's very happy with my answer that this is a better package. But Honorable Speaker, the benefit package is gazetted and is available. The package was passed by this house. How much is for oncology? How much is for dialysis? How much is for... And if the house, through its wisdom, increases the package, we will. But the package was passed by this house. The package under law is due for review by the Health Benefit and Advisory Panel. And I've taken the concerns of Parliament, and Parliament should also provide the budget. But Honorable Speaker, let me even go a different way. Because many members were asking the differences between NHIF and SHA. For surgical tariffs, across all providers, any surgery, they are unstandardized across all the providers. Before you could go to a private hospital, they charge you a different amount that is charged in the faith-based, that is paid for in the private. But now we have said any surgical procedure, whether it's you go to Aga Khan, or you go to a county hospital, or you go to a faith-based hospital, it is standard. 2, the tariff limits have been increased by 12% under SHA. And I want members to look at even the law we have passed. Every tariff, every benefit tariff have been increased by 12%. Under NHIF, the limits were different for different facilities. Different hospitals were charging differently. And Honorable Mama Degorot, Beatrice, let me agree with you. Healthcare is very expensive. And it depends on which hospital you choose. So you must be very careful which hospital you take your patient to. There are hospitals, private hospitals in our country, that if you stay for 5 days, you get a bill of 11 million, when it should be 2 million. I have concerns. So I think in previous parliament, we have discussed the cost of healthcare in our country. Before this house, Honorable Speaker, my committee, led by Honorable Dr. Nyikal, is looking at quality care and patient safety bill. I think we must do amendments to that law to deal with the cost of healthcare in our country. In other professions, lawyers, their costs are regulated. We must regulate as a country. I'm sure those who are doctors who are in this house and the ones who work with me will not be very happy, but we have to say it. The difference between NHIF and SHA, emergency evacuation will soon be launched. There is the ECCIF. Once we do the emergency evacuation, the ambulance will be paid for by SHA. The first 24 hours will be paid by SHA. That never used to happen under NHIF. All Kenyans now will have an access to an ambulance. The days when a patient is taken to a hospital or an emergency and you are asked for deposit is over with Social Health Authority. These are the benefits. SHA will pay for the ambulance. SHA will pay for the first 24 hours. The only package that I think the feedback we got, and we get a lot of feedback. We have a call center, 147. that every day over 5,000 to 10,000 Kenyans call. We get feedback from leaders like you. We get feedback from citizens on their concerns. But the Social Health Authority, the Social Health Insurance Act, the Primary Health Act. Let me tell you the biggest difference between NHIF and SHA. And this is now where I should want to thank this House and the leadership of this country. Primary health care paid by the Exchequer at level 2, level 3, and sub-county hospital is free. You walk in, you walk out. Now let me come to the question of my sister, Samburu West. Yes, if you ask me, if you put a question on those who are co-charging, I will provide. But I think complimenting the ones who are doing good work, I think I'll do it. You know, it's members who oversight. Mine is implementation. But I agree with you. It is criminal, it is unethical, it is immoral for when this House has appropriated resources for Kenyans who access outpatient through the primary health care fund. And the money is supposed to go to the facility as capitation. You're asking Kenyans to buy exercise book, to pay for laboratory. Mr. Speaker, that is immoral, it's a constitutional criminal even in the law that you have passed. And I think a time will come when we shall shame those facilities and in those counties, whether even my referral hospital, if they charge extra than what is provided. On St. Mary's, Honorable Speaker, even if I was a resident of Kakamega, maybe my children also could have been born there. But let me make it very clear, Honorable Speaker, I've even given you the data as one of our leaders. St. Mary to date, SHA has paid 114,548,896. The claims which are with us, which we will pay in November, which is this month, is only 5.5 million. I went to Kakamega myself. I sat with the whole team, our Lord Bishop. We sat with the whole team, the bankers, the SHA team. We reconciled. We did a press conference. But that is a faith-based facility. I cannot go and open it. Now that I have given you the amount of money, the one for NHIF is a legacy debt, just like Consolata Madari Hospital. Honorable Speaker, St. Mary has become a political hospital. I cannot go and open. I am ready to go with you, but I told the Lord Bishop, when you're opening, call me. I'll even bring extra drugs from the Ministry of Health. We're waiting for the day to be opened. So let me send my good brother, please, 114 million have been paid by SHA. 5.5 we will pay. The reason why it's not being opened is beyond my control. It's the way if Nairobi Hospital today closes, and I have paid them the money, and maybe they want to go and open a hotel, there's very little I can do. Honorable Speaker, so St. Mary, that is the case, but we are, as a Minister of Health, we are working, and I really want to ask both Professor Undo and my brother Kibagendi that I need to get the details of those two patients and see those particular hospitals. We have hospitals that also want to co-charge people. They don't want to use the right tariff. It's called decoding. But I'll ask Mercy and myself, Honorable Kibagendi and the professor, just share with me so that we check from the system, and if we feel there is a problem, we will go resolve it. It's part of the feedback we want. But we are working on to reduce the cost of healthcare. Number one, by introducing reforms in the KEMSA, making sure we do bulk procurement to reduce the price of drugs. We want to do contract manufacturing. We want to do strategic purchasing by SHA. And that's why we also introduced the NEST program, where hospitals don't need to pay for equipment, neither the county or the national government. Vendors bring their equipment, they put it there, the number of Kenyans who use that, then SHA will reimburse those vendors based on the number of patients that go through. Honorable Speaker, on Mheshimiwa Jalango, in the journey of UHC, countries must make a choice. And Honorable, I think he has left. Yeah, the choice is, if this House decides to say that we make healthcare free, then we have no problem. We will just create for you the budget. Now the amount we are spending on ECCIF, the amount this House has allocated, it's in its wisdom for PHC, is huge. So if we say that we share, but that's why we cap the chief payments on the income, that we pay more those of us who are at the apex, so that other Kenyans can benefit. And the principal goal is to reduce those ailments which are very catastrophic health expenditure, like cancer, like dialysis. Today, Kenyans can access dialysis, particularly majority who do twice a week. They are fully paid by SHA. You can walk to Aga Khan, and Honorable Speaker, we are opening a new center called East Africa Dialysis Center soon that will operate 24 hours, where even public servants can work during the day and they do their dialysis during the night. The drivers of this dangerous health expenditure, they include surgical packages and oncology. Maybe we need to look at those ones and see as a country what we can do. Honorable Speaker, I think finally the choice of a hospital will also decide the hospital bill. There are certain hospitals, and I want to make it very clear, that they want to make money. You go to some of them, they have got, you know, they charge you the TV, they have a private wing, they charge you their insurance. All those is lumped into the cost of healthcare. So if you go to a private wing of Nairobi Hospital, you'll pay more. But if you go to the private wing of Kenyatta National Hospital with more consultants, better. And I've seen many leaders now are going to Kenyatta Hospital and Kenyatta University Hospital, MTRH. If you go to those referral hospitals, public referral hospitals, you can get, even if you compare even the private, Aga Khan versus Nairobi West versus Nairobi, do your own analysis. So it depends on the choice of the hospital. But we have done an analysis and we have found out that surgical expenses are the drivers of healthcare costs in our country. And Honorable Kibagedi, I can assure you that we will not politicize, but we will just want to give the country the true situation. And we get a lot of feedback. One, in our call center run by Safaricom and Digital Health Agency, the number and the questions Kenyans ask are close to between 5,000 to 10,000 every day. Even now you can call. Total cost of the benefit package that was financed purely from the exchequer, if we have to say that healthcare will be free in our country, will be close to about 410 billion shillings per year. I mean, that is the reality. And the bed rebates, if you go to level 4, finally, Honorable Speaker, if you go to level 4, the bed rebate is 336. If you go to level 5, it's 392. If you go to level 6, it's 448. 50% of that is an increase from the previous NHIF. Thank you, Honorable Speaker.
Thank you, Honorable Speaker, and thank you, CS. For every information, myself, just like all other members, believe in SHA. But then, there are the small health centers in the village, which really assist the people on a daily basis. In my constituency, there are many of them. We have a Sirulo, we have a Musire, we have a Matsuli, we have many of them, including a Lukongo. And I'm one of the people who often gets feedback to the minister. Honorable Speaker, they have never received any SHA monies. And they are SHA monies because they come and talk to me. are small, but they have never received, like a Cirulo, a Matsuli. So they are really surviving. Yet these are the first places where the patients go to in the village. And the village setup is a very difficult setup. Could you speak on this? That why would it happen that since you began, the small health centers have not received? And I'll be more than willing to give you the full list before you go away. Thank you, Honorable Speaker.
Honorable Speaker, if I'm given the list like St. Mary and Consolata, we pay everybody. Primary health care, level 2, level 3, and sub-county hospital, under PHC, we have paid 9.8 billion, 13 months. If I am given the list before I finish, if you give us right now, before I leave the house, Honorable Speaker, I will give the Honorable member how much we have paid those facilities. Just right.
Honorable members, we are now at 6:18. I have 4 questions to go from Honorable Karani, Kawanjiku, Naisula, and Kwenya. Kawanjiku has already had 2 bites. Minister, if I skip Kawanjiku, can you answer the remaining 3 questions in 30 minutes? Minister, if I skip Kawanjiku's question 77 for another day, he has asked 2 questions already. Can we do the remaining 3 from Karani, Honorable Kwenya, and Naisula in 30 minutes? We can. Yes, Kwenya, what's your suggestion?
Mr. Speaker, most of these questions that we have raised are interrelated, and actually,
completely, yes.
Based on the responses that we're getting from the Speaker, I would wish that maybe we read them out, all of us, then we can have responses from the CS. If we have further questions, then we can engage as we're doing.
Then even Kawanjiku will be in the net. Let's start. Stephen Karani, Minister, record all of them, and you'll answer them in 30 minutes.
Thank you, Mr. Speaker. I stand to ask question number 75 for 2025. Can the Cabinet Secretary explain why informal sector workers are no longer able to remit monthly contribution to the Social Health Insurance Fund SHIF under the Social Health Authority SHA, including being required to make top-up contributions when they are receiving medical services from hospital, creating discrimination as this requirement is not imposed on salaried individuals. Number 2, can the Cabinet Secretary
Order, Nabulindo and Oundo, this is not a market in your region.
And the Cabinet Secretary clarify whether any assessment has been undertaken on the impact of requiring annual contributions from informal sector workers on their right to access affordable health care. And finally, number 3, outline the alternative payment models accessible to informal sector workers and measures put in place to ensure inclusivity and flexibility in the remittance of SHIF. I thank you, Mr. Speaker.
Could the Cabinet Secretary A provide a report on the number of Kenyans that have registered with the Social Health Authority, including measures taken by the Ministry to sensitize the public on payment of premiums and the benefits available under the package offered by the authority? Question 2, clarify on whether indigents are subjected to a means testing process, and if so, provide a report on whether claims by indigents have been fully paid for and the number of indigent households that have benefited under SHA. 3, outline the current uptake of premium financing and the utilization of the Lipa Pole Pole scheme under SHA for Kenyans in the informal sector. Number 4, provide the status of recruitment by the SHA and whether staff of the defunct National Health Insurance Fund, NHIF, have been transitioned to the authority. Number 4, indicate the status of the suspension and investigations of health facilities that had integrity issues, including actions taken by the ministry to resolve the matter and ensure accountability by the health facility. Number 5, clarify whether the Lulo and Urban Private Hospitals Associations, RUFA, allied facility are accepting and treating SHA members in their facility. Thank you, Honorable Speaker.
Naisula.
Thank you, Speaker. Could the Cabinet Secretary outline measures put in place to ensure the provision of quality healthcare services and patient safety in health facilities, including the manner in which pre-authorization for admission and procedures is done by the Social Health Authority? Clarify whether the Ministry of Health, the Social Health Authority, and the Kenya Medical Practitioners and Dentists Council conduct inspections of the contracted health facilities to ensure strategic purchasing of services and that SHA members receive quality healthcare services. State measures put in place to ensure availability of drugs in healthcare facilities by Kenya Medical Supplies Authority, including improving the institution's order fill rate and ensure uninterrupted supply of drugs. 4, explain the relationship between the Social Health Authority, the Digital Health Agency, and the Kenya Medical Practitioner and Dentist Council with regard to updating of bed capacity, empanelment, pre-authorization, claim settlements, system downtime, and surgical reviews. Explain why the Social Health Authority Tribunal has not been operationalized, and explain how disputes in relation to billing disputes, claim rejections, and closure of facilities are being handled by SHA, KMPDPC, and the Ministry. Clarify whether Kenyans may seek medical services outside Kenya under the Social Health Insurance Fund, and if so, provide the procedures that are to be followed for getting approvals to be treated outside of the country by the Social Health Authority. Lastly, Mr. Speaker, can the Cabinet Secretary provide a report on the manner which the Social Health Authority empanels and pays health facilities outside of Kenya? Thank you, Mr. Speaker.
Kenya.
Could the Cabinet Secretary explain what entails the Linda Jamii program, including whether there are any benefits categorized for maternal, newborn, and child health? Provide report on the statistics of teenage mothers and their children being treated at the Social Health Authority. State how much has been paid to facilities by the Social Health Authority at the Public Officers Medical Scheme Fund, including how much has been paid to the fund by the Ministry of Public Service. Outline the current status of NHIF outstanding, that is defunct NHIF outstanding debts, and the verification of the outstanding claims. Provide the reasons of or grounds upon which SHA rejects claims, including whether such reasons are provided to health facilities, and the measures put in place to ensure that the 9,000 contracted health facilities are trained on claims, processing, SHA digital systems, and financial accountability. State whether SHA is paying for emergency services provided to Kenyans, and if so, explain how are the ambulances contracted by SHA, including procedures for referrals where ambulances are involved. Indicate the level of ambulance coverage in rural and far-flung areas of the country. Explain how the ministry is engaging and supporting county governments in the implementation of the Facility Improvement Financing Act, that's CAP 277. State the measures put in place to ensure that county laws are aligned to the national legal framework on facility improvement financing, and finally, outline the steps taken by the ministry to regulate organ and tissue donation and transplant in the country. Thank you, Mr. Speaker.
Minister, all those questions are largely overlapping, some touching on issues you have already dealt with. Could you cover them in the next 20, 30 minutes maximum?
Thank you, Mr. Speaker. Mr. Speaker, I also have a very comprehensive answer, which I have given to members. They can look at it, and I'm ready to engage them further. Honorable Karani was talking about why the informal sector and SHA lipa pole pole. I think all that together, if you put it, it tells you that the mean testing is working. And up to today, 1.8 million informal sector contributors have successfully registered, nearly doubling the previous annual enrollment rate of 51,000 individuals who are now actively. Every evening, 2,000 to 3,000 Kenyans go through the SHA lipa pole pole, outside those others who pay through the informal sector, who go through the mean testing. Honorable Speaker, Honorable Kawanjiko is asking the same question I also answered earlier. How many Kenyans are registered? As of 3rd of November?
Yes, Robert, what's the point of order?
Mr. Speaker, I've heard the CS allude to the issue of lipa pole pole. Mr. Speaker, isn't it a fact that now anyone in the informal sector is supposed to pay annually upfront? That lipa pole pole system was actually scrapped. Maybe he needs to clarify, Mr. Speaker.
Okay.
No, I think SHA lipa pole pole is annual contribution. Honorable Mbui, I'll tell you, if you listen, I'll tell you. SHA lipa pole pole means, first, there are Kenyans who pay through the informal sector who pay, go through the mean testing, they pay annually. Now, when you go through the mean testing and your contribution is, for example, annually 6,000, and you don't have money, then SHA lipa pole pole kicks in. It asks you, you pay 4 months. And the balance 8 months, you now use SHA lipa pole pole. Will you pay daily, weekly, monthly? And then you, let me finish. Because unless you go through the mean testing, when you go through mean testing as an informal Kenyan, for example, boda boda, it tells you your annual payment is 7,200, for example, and you have only money for 4 months. Okay? You pay the 4 months, then it gives you a guarantee. There's no interest, there's no levies, there are no taxes. It pays for you the 8 months. Once it guarantees you to pay the 8 months, then the next question it is, do you want to pay the 8 months on a daily basis, on a weekly basis, on a monthly basis? If you say, for example, weekly, every Friday, you'll get a text message on your phone telling you you are to pay 100 shilling, for example. If you don't pay, then the next week, it will tell you you have to pay 200. And Mr. Speaker, as of today, 1.8 million Kenyans in 13 months have paid their annual contribution from the informal sector. Honorable Speaker, just to move, but my 25 minutes will be over. Okay, no problem.
Naisula.
Thank you, Speaker. On the issue of lipa pole pole and a lot of other matters on SHA and payment, Mr. Speaker, and with our interaction with our constituents, they do not have the information. And there's a lot of confusion. Today, there's this circular, this policy, people are getting a bit confused. So if maybe there would be better channels of communications and to reach everybody. So whether it's the local radio stations or whatever, run programs where Kenyans can understand, because I can assure you, if as a member of parliament, sometimes I'm a bit confused. You can imagine someone in the informal sector understanding what is lipa pole pole, lipa annual. You cannot be treated before you do the annual. I just think it's the communication aspect of it that Kenyans are having a challenge with the whole payment issue.
Yes, Milemba.
Thank you for this question. And here, CS, we really must help Kenyans. It's not a win or lose situation. The lipa pole pole is not working. Yesterday, a widow in my own constituency at Muhaya hospital and a desperate person could not get SHA. And we tried all efforts to see whether the lipa pole pole could work. It's not working, they said no. So we ended up paying 7,800, which I paid myself, and I have a message here. If we fixed Lipa Pole Pole, it would really help Kenyans. So when we are dealing with this particular one, we must not win out of an argument, but just go to the real issues that let's make the Lipa Pole Pole work. We shall be happy and you will be happy. Thank you, Honorable Speaker.
Minister.
Honorable Speaker, I want to go on record. Every night at 10 p.m., myself and the leadership, including the president, we receive updates of how many Kenyans register with the Social Health Authority. Last night, and I can table it, over 2,000 Kenyans across the country went through SHA Lipa Pole Pole and paid money close to 5.1 million shilling every night. And I can give this house the whole data for the last 6 months. I was a cabinet secretary. It's working, and it's very popular, and it is going to make the social health insurance fund sustainable. 2, I agree with my sister, 13 months. Even as leaders, on your Twitter, Honorable Lesuda, I will send you. And I told you, you are one of the people. It is not rocket science. You went to the vernacular. And I want every leader, myself, I'll go to the vernacular. It is not only the healthcare of all Kenyans. We will provide, I will go to all the vernacular myself. I have done it on social influencers, very key. This is something we must sell. In fact, the most important element why we introduced social health insurance was to make sure NHIF was more of a club. It was for the salaried people. And that is why our speaker today is paying 46,000 and members are paying close to 32,000.
No, I pay 58,000.
Yes, he pays 58,000 so that those who are going through the mean testing can be covered and healthcare becomes accessible. Honorable Speaker, the last time I was here, you told me 46.
I pay 50,
I think now you need to look at it.
I pay 58,700.
And I am ready, Honorable Speaker, to
On
come
my
to a
payslip.
Kamkunji and take members through SHA Lipa Pole Pole. But I agree, I want to look for the vernacular sessions based on different regions, bring them together and take them through this SHA Lipa Pole Pole. But it's working. Many Kenyans have gone through it. And that's why today we have Honorable member for Kawanjiko, Honorable Kawanjiko.
Minister, to be on the safe side,
27.
say it is working, but it's work in progress.
Yes. The whole of SHA, Your Honorable Speaker,
yes.
The whole of SHA is 13 months old. The system is 8 months old. So let us not treat it, this baby is just walking. And we are getting very good feedback from leaders, and we will keep on improving. A good example, Honorable Speaker, that Honorable Milemba asked me, we have 440 facilities in counties, and we have written to COG that have no bank accounts. So if you have facilities that their bank accounts are not with the SHA, we will not pay them, but we have their money. No, we are checking yours. If they have no bank accounts, then we will not pay, but we have the money, Honorable Speaker. And we have told him to give us the list. Honorable Speaker, there's a member who asked us about the donors, the indigents. I have provided the list from UHNCR. Murang'a County had the highest, Kasipul, Laikipia East, Nakuru East, Kikuyu constituency, Lang'ata, Rana Motors, Tarbo.
Murang'a County has the highest indigents.
Highest number of indigents that they have paid for, 37,000.
What about Turkana?
Turkana has not paid for. Okay. But there are a number of counties that have committed, including Kajiado, including Vihiga, including Kakamega, the ones we have. And we do a rollout of SHA. A number of governors, a number of members of parliament have committed. Honorable Speaker, the legal framework and transition of former NHIF staff, we have agreed. It is this house that has reduced the administrative cost of SHA from 18% of their budget to 5%. And because of technology, the staff also was reduced from 1,800 to 800. close to about 900. Those who will be observed through competitive recruitment to SHA, we have done it and we are continuing. Those who have not, they will be placed in other public institutions at the same salary, at the same scale. So that because they have mortgage, they have other commitments, they don't lose it. That commitment, I have made it. Last time when I was here, I tabled the letter from Head of Public Service and from Public Service Commission. And the number of people we have employed from the Chief Executive Officer, Dr. Mwangangi, to all the directors, to the deputy directors, to the assistant directors, we have employed close to 65 and we keep on. On enforcement, I've said fraud detection and claims rejection, close to 10.6 billion have been rejected in fraudulent claims. We have regulatory facility closure. KMPDC has the powers to register, to upgrade, to downgrade, to close as a regulator, and it has revoked the license of 454 facilities, and it has closed 546 premises. And all this is because of non-compliance. They claim to have a theater, and they don't have a theater. SHA has also suspended a total of 85 facilities for fraudulent activities. We have submitted a number of files, I have said earlier, to the DCI, and the ministry has also submitted 1,180 files for further interrogation to the criminal justice system. Status of prosecution by the ODPP as of 4th of October, a number of people, both staff and facility owners, have been taken to court. Honorable Speaker, on the rural urban private RUFA allied facilities, Honorable Speaker, let me make it very clear that facilities are the ones who sign contracts obligation with the SHA. Bodies that represent, there is a Kenya Private Healthcare Federation, there is RUFA. All that they can do is to lobby for their members. They have absolutely no construction obligation on SHA. Every facility will engage with the Social Health Authority and its leadership through the contract they have signed. But we do active engagement, we do structured dialogue, and we do operational support. And we, as we said, we empaneled close to 10,540 facilities across the country. Honorable Speaker, the ministry is implementing a very comprehensive measures to ensure that the provision of quality health care and patient safety are there too. And we are doing that through making sure that we do an oversight on all facilities and their compliance. We deal with anti-fraud measures. Our digital system, AI-powered fraud engine, eliminates fraudulent practices like upcoding, phantom billing, falsification of records, and all these will compromise if we allow the financial sustainability required for quality health care of our citizens. Honorable Speaker, there was a question on whether the Ministry of Health, SHA, KMPDC conduct inspection. Yes. Kenya Medical Practitioners and Dentists Council and the Clinical Officers Council are the designated licensing authorities mandated by law. They evaluate service readiness, they ensure compliance with the facility, they conduct site inspection on new facilities, they check the location, the infrastructure, the service, and the human resource. The role of SHA is just contingent upon the regulatory body's licensing status. SHA utilizes DHA, the Digital Health Agency, digital system and its forensic audit, just to monitor claims and then use the same system to suspend the various facilities, like the 85, because of fraudulent activity. SHA new computation model for PHC, Honorable Speaker, promotes very strategic purchasing. Honorable Speaker, on the measures to ensure availability of drugs, which is very, very important by KEMSA. Honorable Speaker, KEMSA, in line with mandate under the KEMSA Act and the UHC agenda, we are doing a number of reforms. to make sure that the authority fill rate, which is now at 67%, goes up to 90% by the end of the year, so that drugs are available in each and every facility, more so public facility. And this we have agreed with the cabinet and the Council of Governors to make sure that KEMSA is not known for the COVID billionaires. KEMSA will be the KEMSA that will serve each and every Kenyan at his village and next facility. And we are doing this through a number of reforms which I've stated in the documents that I will present. I've just presented. On, yes, there is a table between that I have given responsible agency and their role distinction. KMPDC, SHA, and all that is provided. Handling of the dispute tribunal. Honorable Suda, I think that dispute tribunal ideally is supposed to serve as an independent body for appeals against SHA decision. We have developed ourselves the required rules, the social health insurance tribunal procedure and the rules, but this tribunal has not appointed due to government plan and also the judiciary that says all tribunals under the judiciary should be under a new bill, Tribunal Bill 2023, which is before the House. Once that is complete, then the tribunal, appeal tribunal of SHA will kick in. But for us as a ministry, we are ready, we are willing, we are committed, and we have put everything in place in terms of procedure and rules. Honorable Speaker, on whether Kenyans seeking medical service outside, yes. There was a lot of corruption also in this area. There was something going on between certain healthcare workers and hospitals in some parts of the world, where Kenyans were being referred to when they can get the same services in our country. Today, Honorable Speaker, we have done for the first time 54 Kenyans got who could not hear, who could not speak, who could not talk. Young children, cochlear implant was done at Kenyatta. 54 of them, and 10 was done in MTRH. This is one of the treatment that Kenyans were going abroad. We have the expertise, we have the doctors, we have the specialists. So we have said there are only 37 treatments that if you want to use the resources of SHA, that you can go out. The rest, you must be at home. You know what happened during the COVID, Honorable Speaker, in India, where many Kenyans died and their bodies could not come back. And Honorable Speaker, we want to turn our country. Our hospitals, both private, public, and faith-based, are the best in the region. So we must make sure that not only our foreigners who come for medical tourism, but even our own people. On Linda Mama, defunct Linda Mama and Linda Jamii, Honorable Kenya, I have given a table. For Linda Mama, it was only maternity only, but for Linda Jamii, it's full household health cover. Pregnant women and newborns was only covered under Linda Mama, which was also budgeted here. Sometimes it was a victim of supplementary. In fact, by the time we were doing SHA, Linda Mama had a debt of a pending bill of 4.9 billion. Linda Jamii deals with all vulnerable mothers, spouses, and the children. It gives full range of service under SHA funds, whether it is PHC, whether it is SHIF, whether it is ECCIF. It's fully covered. It covers the whole family, and it gives full insurance coverage. But Linda Mama was only restricted to maternity, limited to the mother and the child, and I have given all these services. Under maternity, SHIF covers normal delivery 10,000, C-section 30,000. For Linda Mama, the defunct, it was about 5,000, and it was paying different figures for different facilities. Public health facilities, they were being paid 3,000. Private, Linda Mama was paying 5,500. Faith-based, they were being paid, I think, 4,900. So the primary health care fund provides free treatment for all common diseases. Honorable Speaker, the other question was how much has been paid to facilities by SHA under the Public Officers Medical Scheme. This is very important, Honorable Speaker. The Ministry has developed a new working arrangement to sustain Public Officers Medical Scheme Fund, guaranteeing that service remain accessible, provide budgetary allocation through this house, which are made available. So far, SHA has received from the Ministry of Public Service 4,100 million. And this is for this Public Officers Medical Scheme Fund. The amount paid to facilities, SHA has already paid out of that 2.4 billion to facilities under the scheme. Outlining the current status of NHIF outstanding debts, I think that, Honorable Speaker, I have answered it very comprehensively. And I think the only last question is state whether SHA is paying for emergency service provided to Kenyans, and if so, explain how the ambulance system work by Honorable Kenya. The Honorable Speaker, payment for emergency service, emergency treatment is covered under the Emergency Chronic and Critical Illness Fund and is accessible to all Kenyans, regardless of registration or premium payment status. So emergency treatment service is, again, like PHC, is free and no Kenyan will be denied. So emergency care is provided for up to 24 hours. On the ambulance contracting and referrals, the benefit package says SHA is rolling out an ambulance evacuation service benefit package under the ECCIF fund that the House has created. The tariff structure is 4,500 for within 25 kilometers. So if an ambulance picks you from point A to the nearby facility, SHA will pay 4,500. Outside 25 kilometers, 75 per kilometer for extra kilometer service. We are contracting both county and private ambulances, and this will be just like the way Uber runs. Our command center, you call it, they will tell the nearest ambulance to come to you, pick you, take you to hospital, SHA pays the money, and the first 24 hours, all the treatment, whether it is surgical, will be paid by the Social Health Authority. So it's free. And I think the Kenya Medical Practitioners and Dentists Council, the regulator, has put the adverts. And Honorable Kenya, as a businessman, you can also invest in the ambulance. But the standard is very high. The standard is very, very, very high. Honorable Speaker, the SHA board is in the process of implementing a nationwide ambulance service across all our 47 counties, designed to complement the efforts of our county governments. Finally, Honorable Speaker, the last question is to explain how the ministry is engaging and supporting county governments in the implementation of the Facility Improvement Act, CAP 2022. Honorable Speaker, this Facility Improvement Financing Act requires all public health facilities, level 2 to level 5, to establish structures for collection, retention, and management of revenue from health services. And this aim is to improve local facility operations. The money should not pass through the county treasury. It should go directly to the facility. They can buy drugs, they can hire healthcare workers on locum, they can improve on the facility. But Honorable Speaker, we need to engage. The Committee of Health of the National Assembly has gone around the country during recess, and they have found out a number of issues. One of them is counties having their own FIF legal regime. And I want to make it very clear through you, Honorable Speaker, if you allow me, that national legislation always supersedes county assembly legislation. So there's no way you can use the county assembly law to undermine the law passed by this house. And this must be very, very clear. If you do that, then you contravene the law. But the operation of SHA inherently supports FIF implementation by making sure there is a cash flow to these facilities. The capitation and the claims payments directed to the fund will help them manage their funds locally. We'll also streamline their ordering way so that SHA and KEMSA are now ordering directly from the facilities. And then there is alignment of the laws. The ministry defers the detailed updates of alignment to our county laws, to the Council of Governors. We have discussed and they are looking at it. Honorable Speaker, I have a very detailed report which I can table for members to look at it, and if there's anything...
Indeed, members, each of you, there is a very detailed response to your questions. If you haven't received yet, you can pick from the table office. Chair, Health.
Thank you, Mr. Speaker. Let me start by appreciating the Cabinet Secretary for the detailed report he has given, which to a large extent is actually correct. In terms of design and intention, the ministry is doing a fantastic job. And I think the only issue that is coming is actually when you go on the ground on implication, there are areas that there are still gaps. We have discussed this with them, and as you can say, and I'll mention just a few, but that is the basic thing. It is like the issue...
Do it in 3 minutes.
3.5. So, in the issue of registration, that SHA pole pole is a problem to people. And if it can be done, it will make things work much better. 2, in the area of benefit package, again, there is a problem there, and the minister says rightly that it passed through Parliament, but it passes as delegated legislation, which means if it goes through, then it doesn't really come through the committee, and we have acted with them. We will actually have to look at the benefit package and the tariffs. And like the case of Honorable Undo and Honorable Kibagendi, it's extremely simple what's happening there. Honorable Kibagendi's mother had diabetes, which was the basic problem. And that basic treatment was for diabetes. But then she had a wound in the foot because of diabetes and I think a toe. So the diabetes had to be treated and then the surgery done and I think the toe amputated. Now, the benefit package looked at the surgery and paid for the surgery, but not the treatment of diabetes. So these are the areas we really need to look at. So if you look at then the primary care, again, very quickly, and I'll ask members, please go to our health centers and dispense level 2s and level 3s and even level 4 outpatient. Ask patients, are you getting treatment and coming out without paying? Because this is what, as a committee, we actually did and will give back. And the FIF, Mr. Speaker, the minister is right, that it is in law, but we have looked at that and there's already a proposal from our committee on how to look at that and remove the power from the counties of varying it. So what we are really, and cancer, for example, what is happening? There was 400,000, but when ACCFI came, the emergency and chronic care, they added 150,000, make it 550. But what is happening, there's a difference between the package and the tariff. So if these patients are getting chemotherapy, it's something about 84 to 100,000, and they're getting 10 to 12. It is already above 550. So these are really the issues that we are having. So I think the ministry is doing well. We'll work with the committee. The committee will work with them and really get the details. The issue of claims and rejection of claims, again, issue of communication. What Honorable Jalango said is so key from what we saw in the ground, Honorable Minister. We need a big communication strategy to go out to the level, almost like we campaigned for the Constitution. I think if we do that, we'll get it right. I didn't want to say more because we'll give a report to this House that actually covers virtually all the areas that we have done here, Mr. Speaker. Thank you very much. But SHA can work if we look at it carefully, we leave out politics and try to control business, it will work.
Thank you, Chairman. We'll end there on questions. Minister, you are released with your team. Call out order number 12. No. Order number 11, sorry. Order number 11. We're done up to 10.
Order number 11, special motion, consideration of nominee for appointment as member of the Salaries and Remuneration Commission.
Chairperson, Departmental Committee on Labor.
Thank you, Speaker.
Chonga.
Honorable Speaker, I beg to move that, taking into consideration the findings of the Departmental Committee on Labor on its report on the approval hearing of a nominee for appointment as a member of the Salaries and Remuneration Commission laid on the table of the House on Tuesday, 4th November 2025, and pursuant to the provision of Section 7, subsection 11 of the Salaries and Remuneration Commission Act, Cap 412D, and Section 3 and 8 of the Public Appointments Parliamentary Approval Act, Cap 7F, this House approves the appointment of the Honorable Engineer Michael Toya Kingi as a member of the Salaries and Remuneration Commission. Honorable Speaker, following the notification of presidential action nominating Honorable Engineer Michael Toya Kingi for appointment as a member of the Salaries and Remuneration Commission to represent the Public Service Commission, and the subsequent communication by the Honorable Speaker and referral to the Departmental Committee of Labor, the Clerk of the National Assembly on the 9th of October 2025 facilitated placement of an advert in the print media notifying the public of the date, time, and place of the approval hearing of the nominee. B, in compliance with Section 9 of the Public Appointments Parliamentary Approval Act, the clerk invited the public to submit memorandum by way of written statements on oath affidavits on the suitability or otherwise of the nominee. C, to fulfill the requirement of personal integrity, the clerk on the 8th of October 2025 brought to the Kenya Revenue Authority, the Ethics and Anti-Corruption Commission, the Director of Criminal Investigation, the Higher Education Laws Board, the Director of Public Prosecution, and the Registrar of Political Parties to ascertain the nominee's integrity and good standing with the said agencies. Honorable Speaker, the nominee appeared before the committee on Tuesday, 21st October 2025, and was orally interviewed under oath, having nominated pursuant to Article 230, subsection 2, B, subsection 2, and 50 of the Constitution, the Public Appointments Approval Act, Cap 7F, the Salaries and Remuneration Commission Act, Cap 412D, and the National Assembly Standing Orders. Honorable Speaker, the committee, having considered the nominees filed questionnaire pursuant to Section 6, subsection 8 of the Public Appointments Parliamentary Approval Act, Cap 7F, the curriculum vitae, and having had his oral submission during the approval hearing, made the following findings. 1. The nominee is a Kenyan citizen and does not hold dual citizenship. Thus, he satisfies the requirements of Article 78, subsection 1 and subsection 2 of the Constitution, which bars a state officers from holding dual citizenship. 2. The nominee presented his academic credentials and professional certificates, and during the approval hearings, demonstrated his suitability in accordance with the provisions of Section 6, subsection 7 of the Public Appointments Parliamentary Approval Act, Cap 7F. 3. The nominee does not hold any office in political party, a requirement under Article 77, subsection 2 of the Constitution and the schedule to the Public Appointments Parliamentary Approval, Cap 7F. And 5. In line with the provision governing the personal integrity, the committee exercised due diligence and contracted the clearing agencies to ascertain nominees' integrity and good standing with the said institutions. According to information available to the committee by the nominee and the various clearing agencies, the nominee meets the requirements of Chapter 6 of the Constitution on leadership and integrity. Further, the nominee has not been charged in a court of law in the last 3 years and has not been adversely mentioned in investigatory report of Parliament or any other commission of inquiry in the last 3 years. 6. Pursuant to Section 6, Subsection 9 of the Public Appointments Parliamentary Approval Act, Cap 7F, the committee did not receive any written statement on oath contesting the suitability of the nominee. 7. Noting the findings of the report on the selection panel of the recruitment of a member of the Salaries and Remuneration Commission, the nomination of Honorable Engineer Michael Thoya Kingi was in compliance with the Constitution and the Public Appointments Parliamentary Approval Act, Cap 7F. 8. And finally, the nominee demonstrated extensive knowledge and experience in public management and administration and topical issues such as the status of remuneration in public service sector, including the menace of ghost workers and the suitability of the public wage bill. In addition, Mr. Speaker, the nominee, if approved, undertook to enhance the Commission's consultations and engagement with relevant stakeholders, including Parliament, to strengthen interinstitutional relations. Honourable Speaker, having conducted the approval hearing pursuant to Article 230, subsection 2, B, subsection 2 of the Constitution, Section 3 and 8 of the Public Appointments Parliamentary Approval Act, Cap 7F, Salaries and Remuneration Commission Act, Cap 412D, and Standing Orders 216, subsection 5, subsection F, the committee recommends that the House approves the appointment of Honorable Engineer Michael Thoya Kingi as a member of the Salaries and Remuneration Commission. Honorable Speaker, I beg to move and request Honorable Owen Bayer to second. Thank you.
Honorable Bayer, proceed.
Thank you very much, Honorable Speaker. Honorable Speaker, I want to take this opportunity in the onset to say that I second this motion and the report, Honorable Speaker, so that the Honorable Engineer Michael Thoya King be appointed as a member of the Salaries and Remuneration Commission. Honorable Speaker, the Michael Thoya Kingi was a member of the 12th Parliament. We worked with him here. He served in several committees, and he showed his ability to actually lead when he was here. Honorable Speaker, the Michael Thoya Kingi, an engineer, he has worked, and now he has worked as a managing director of Malindi Water Sewerage Company, Mawasco. And during his tenure, he showed leadership, Honorable Speaker. In a position like this, what we need is a person who would be able to display leadership so that the issues of remuneration in this country can actually be streamlined as envisaged in the Constitution. And therefore, Honorable Speaker, the person of Michael Thoya King, his ability, his academic levels, his work, his experience, and his ability to network and to talk to people and actually be able to work well in a team, Honorable Speaker, gives him a head start as we request this Parliament to approve him to be a member of the Remuneration Commission. Honorable Speaker, with those many remarks, Honorable Speaker, I second. And as pronounced by the Honorable Acting Minority Leader, I request that you take the heed and call the question.
Order, Honorable. Let me propose the question first. Let me propose the question. Honorable members, I now propose the question, which is that taking into consideration the findings of the Departmental Committee on Labor in its report on the approval hearing of a nominee for the appointment as a member of the Salaries and Remuneration Commission laid on the table of the House on Tuesday, 4th November 2025, and pursuant to the provisions of Section 7, in brackets 11 of the Salaries and Remuneration Commission Act, Cap 412D, and Sections 3 and 8 of the Public Appointments Parliamentary Approval Act, Cap 7F, this House approves the appointment of the Honorable Engineer Michael Thoya Kingi as a member of the Salaries and Remuneration Commission. Proceed, we give you the first chance to speak on this.
Asante Mheshimiwa Spika kwa kunipa fursa hii. Kwanza tutambue kwamba katika katiba yetu ambayo tunaitumia ambayo tuliipitisha sisi mwaka 2010 ni kwamba katika uteuzi wowote ambao unafanyika katika tume ni lazima kuwe kuna uwakilishi, katiba ikitambua kwamba ni lazima kuwe na uwakilishi wa kimaeneo, ambapo kwa muda mrefu maeneo yetu ya pwani, eneo letu la pwani huwa linaachwa nyuma kukija kwa uteuzi kama huu. Kwa hivyo ningetaka kumpongeza Michael Kingi kwamba kwa mara ya kwanza tumeweza kupata uteuzi huu katika tume hii ambayo kutoka ianzishwe na tume zingine hatuja kuwa na mwakilishi kutoka maeneo ya pwani. Pili ni kushukuru Spika kwa kunipa hii fursa, kwa sababu katika masuala ikija ya mishahara ni lazima kuwe kuna mwanahesabati pale. Mimi kama mhandisi, kama vile alivyo mhandisi Michael Kingi, titakuwa ni jukumu letu kuangalia zile nambari ndogo ndogo, kuangalia yale mahesabu na kuona ni vipi, ikiwa ni katika kugawiwa, ikiwa ni katika kuongezwa, basi hesabu zinafanyika ambazo zitanufaisha mwananchi na zitakuwa katika ile hesabu yote ya Kenya kwamba tuweze kuendelea mbele. Kwa hayo machache na hiyo fursa, naunga mkono uteuzi huo. Asante Mheshimiwa Spika.
Before I put the question, yes, Honorable. That's Honorable who, please?
This is Honorable Fatuma Masitu, County MP.
Proceed, Honorable Fatuma Masitu.
Thank you, Mr. Speaker. Basi niseme asante Mheshimiwa Spika, na pia nimpe kongole Michael Kingi ambaye alikuwa mbunge katika bunge hili. Sasa hivi naona anakwenda kupata nafasi hii, na ningeomba wabunge wenzangu tumuunge mkono. Mbali na kuwa yeye ni mpwani na ni Mmijikenda, sisi jamii yetu ilikuwa imewachwa nyuma sana. Lakini pia nimshukuru Mheshimiwa Rais kwa kutambua wapwani safari hii. Kila nafasi zinapotokea tunaona wapwani mmoja wawili wameweza kupata fursa hii. Na nimwambie kakaangu au ndugu yangu Michael Kingi, pindi utakapopata nafasi hii basi ujaribu sana kuwa mzalendo na ujue Kenya hii ina makabila mengi, Kenya hii ina nafasi tofauti tofauti, tushikane kama Wakenya kama vile Daktari William Samoei Ruto anavyofanya kwa Wakenya wote. Asante sana Mheshimiwa Spika.
Thank you, honorable members. There being no more interest in this particular one, I'll defer putting of the question until tomorrow at 2:30. Very well, well directed, the mover. You may reply.
Much appreciated, Speaker. You and me know the nominee very well. Honorable Michael Kingi was a very sober person, looking at his record, even on answered in this chamber in the 12th Parliament. And his humility deserves being rewarded in such kind of nomination, in that he is one person who is not biased in whatever judgments he has been making. I therefore take this opportunity to urge members, just like what Honorable Fatuma has said, that we support the member for that position. Thank you, Mr. Speaker.
Very well, as earlier directed. Let's move to the next order.
Order number 12, motion, fourth report on the implementation status of the report of the Committee on Delegated Legislation on its consideration of Public Procurement Regulatory Authority Circular number 04/2025.
Chairperson, Committee on Implementation.
Thank you, Mr. Speaker, sir. Honorable Speaker, I beg to move that this House adopts the fourth report of the Select Committee on Implementation on the Enforcement of Compliance with the Mandatory Use of the Electronic Government Procurement System, EGPS, by all public procuring entities laid on the table of the House on Tuesday, 14th October 2025. Honorable Speaker, this report contains the proceedings of the Committee on Implementation in its oversight of the status of resolutions from the Committee on Delegated Legislation's report on the Public Procurement Regulatory Authority Circular on the enforcement of the mandatory use of the Electronic Government Procurement System, EGPS, by all public procuring entities, Circular number 04 of 2025. The follow-up was conducted after the adoption of the report tabled by the chairperson of the Committee on Delegated Legislation, Honorable Chepkonga Kiprono Samuel, CBS, MP, on 19th August 2025. Honorable Speaker, the report arose from the morning sitting of the National Assembly on 14th August 2025, when the Honorable George Gitonga Murugara, CBS, MP, laid before the House the Public Procurement Regulatory Authority Circular number 04 of 2025. Here, after referred to as the circular dated 12th August 2025 on the enforcement of compliance with the mandatory use of the Electronic Government Procurement System, EGPS, by all public procuring entities. Honorable Speaker, Honorable Murugara observed that the circular appeared to carry the force of law by declaring non-compliance an offense, thus necessitating its submission to parliamentary scrutiny. He accordingly sought the guidance of the Honorable Speaker for the circular to be referred to the Committee on Delegated Legislation for examination and approval as mandated by the Statutory Instruments Act Cap 2A. In response, the Honorable Speaker directed that the Committee on Delegated Legislation undertake scrutiny of the circular in accordance with the applicable legal provisions. Honorable Speaker, during the consideration of the report, the committee observed that the purpose of the circular was to enforce compliance with the mandatory use of the Electronic Government Procurement System, EGPS, by all public procuring entities. This, as noted by the Committee on Delegated Legislation, had contravened Article 227(1), which requires a procuring entity to ensure a fair, equitable, and transparent procurement process. Furthermore, Section 77(1) of the Public Procurement and Assets Disposal Act stipulates that tenders may be submitted through both electronic and manual systems. The Committee on Delegated Legislation had recommended that the House declare that circular number 4 of 2025 a nullity, pursuant to Section 18 of the Statutory Instruments Act, Cap 2A. Honorable Speaker, the Committee on Implementation, having reviewed the report of the Committee on Delegated Legislation regarding the Public Procurement Regulatory Authority Circular on the enforcement of compliance with the mandatory use of the Electronic Government Procurement System, EGPS, by all public procuring entities, circular number 4 of 2025, noted that circular number 4 of 2025, dated 12th August 2025, had been annulled by the House. However, the committee observed that the annulment of circular number 04 or number 4 of 2025 did not consider that compliance with the mandatory use of the EGPS could continue through a cabinet directive issued during its fourth meeting on 24th June 2025, which established EGP as the primary procurement method for all government transactions. Additionally, the committee noted that the House did not annul 2 previous circulars. A, circular reference number NET/PPD/1/3/1/14, volume 6 by the Cabinet Secretary, the National Treasury and Economic Planning dated 26th March 2025, directing accounting officers to transition to the EGP system with effect from 1st July 2025, and B, circular number OP/CAB6/2A dated 5th June 2025 from the head of public service, reiterating the need for all procuring entities to onboard into the EGP system. Honorable Speaker, the committee also observed that while the circulars and directives on mandatory use of the electronic government procurement system, EGPS, by all public procuring entities from the executive have legal underpinnings in the Constitution and laws such as the Public Procurement and Asset Disposal Act Cap 412C. Implementation needed to take into consideration challenges faced by public entities and the general public regarding onboarding EGPS, such as geographical remoteness, lack of internet, electricity connection, and technological challenges. Honorable Speaker, considering the conundrum that the entire procurement system in the country is currently entangled in, the committee, in consonancy with the requisite legal provisions, made the following recommendations upon the adoption of this report. 1, that having considered the contents of the following circulars, A, circular reference number NT/PPD/1/3/14, volume 6 by the Cabinet Secretary, the National Treasury and Economic Planning, dated 26th March 2025, directing accounting officers to transition to the EGP system with effect from 1st July 2025, and B, circular number OP/CAB6/2A dated 5th June 2025 from the head of public service, reiterating the need for all procuring entities to onboard into the EGP system, which occasioned the issuance of circular number 04 of 2025. The committee concurs with the annulment of circular number 4 of 2025 of 12th August 2025 by the House. Further, the committee recommends that the House declares the above circulars A and B nullity, as they create ultra-vires provisions which were in contravention of Article 227 of the Constitution and Section 77(1) of the Public Procurement and Assets Disposal Act Cap 412C. 2, the committee recommends that henceforth the Cabinet Secretary, the National Treasury, and Economic Planning submits regulations to accompany any new circular on the electronic government procurement system for consideration by the National Assembly. 3, the committee notes that monies appropriated in the financial year 2024-2025 have been disbursed. The committee recommends that the implementation of projects for the financial year 2024-2025 proceeds according to the approved procurement plans in strict compliance with the provisions of Section 77(1) of the Public Procurement and Asset Disposal Act. This section permits the use of both manual and electronic procurement methods, ensuring flexibility and efficiency in the procurement process. Unless an amendment is made to the same, the law stands. Finally, Honorable Speaker, having noted the proceedings of the Committee on Implementation of the Enforcement of Compliance with the mandatory use of the Electronic Government Procurement System, EGPS, by all public procuring entities, I beg to move and urge the House to adopt this report. I now request the Honorable Mark Mwenje Mreithi, CBS, MP, to second this motion. Thank you, Mr. Speaker.
Honorable Mark Mwenje. Thank you, Honorable Speaker. And from the onset, as I second this motion, that is been brought by the Committee on Implementation on the enforcement of compliance with the mandatory use of the EGPA by all procurement entities, as laid on the table of the House on Tuesday, 14, 2025. Honorable Speaker, I'd like to reiterate the words of the chairperson pertaining this particular report that has been tabled and moved. And on the quagmire that is facing the government and the procurement sector in this country. Honorable Speaker, allow me to remind the plenary that the core mandate of the National Assembly as per the Constitution is to legislate, oversight, and represent. As it currently stands, our role has been usurped by the Cabinet Secretary of the National Treasury on issuance and relying on circulars that have the effect of law and bringing developmental crisis by creating a gridlock in matters of procurement. Honorable Speaker, as it currently stands, there's an impasse when it comes to procurement, and this is a result of these 3 circulars, Honorable Speaker. The circulars that have been, I'll not go through them because they've already been mentioned by the chairman, but more importantly, Honorable Speaker, Circular 4 of 2025 was the one that was nullified by this House. But more importantly, the Cabinet Secretary is relying on 2 other circulars dated 26 March 2025, and these by the Cabinet Secretary. And then there's a second circular dated 5th June 2025 from the Head of Public Service. These are the 2 circulars, Honorable Speaker, that the Cabinet Secretary is using to rely, despite nullifying the PPRA Circular number 4. Honorable Speaker, the committee noted the illegality of the said circulars. We met with the Cabinet Secretary who attended our meetings and we went through them. But he was adamant at the time that those circulars were valid, Honorable Speaker. And therefore, that's why the committee has brought it to this House so that those circulars that have been relied on are nullified by this House, and the House holds that power. Honorable Speaker, let me just mention some points of the Constitution. Article 2271 and 2272. 2271 provides that when a state organ or any other public entity contracts for goods or services, it shall do so in accordance with a system that is fair, equitable, transparent, competitive, and cost-effective. Honorable Speaker, this EGP system completely violates all those points. It is not fair, because there are areas that cannot use it. It's not transparent, Honorable Speaker. And Honorable Speaker, I might want to reveal here that we inquired, where did the system come from? And we now know that the EGP system came from some people in India. They're the ones who designed it and brought it to us. So when it comes to matters of competition, how competitive is this system? It means people, those entrepreneurs in Nairobi are at advantage compared to people who come from far-flung counties, Honorable Speaker. Article 227(2)(b), Honorable Speaker, provides that an act of parliament shall prescribe a framework within which policies relating to procurement and asset disposal shall be implemented and may provide for all or any of the following: the protection or advancements of persons, categories of persons or groups previously disadvantaged by unfair competition or discrimination. The implication of this on the normal mwananchi like Mama Mboga who cannot access such facilities across the country when supplying our goods to some public institution is being felt across the nation, Honorable Speaker. This system seeks to be a cornerstone of transparency and accountability, but currently it has caused mayhem and as a result financial atrocity to many business people doing business with government entities. Honorable Speaker, Section 72C of the Public Procurement and Asset Disposal Act, Cap 412, establishes the role of the National Treasury on public procurement and assets disposal. In the performance of its role, subsection 1, the National Treasury shall design and prescribe an efficient procurement management system for the national and county governments to ensure transparent procurement and asset disposal as contemplated by the earlier Article 227. Provided, Honorable Speaker, that the National Treasury shall prescribe through regulations a system that this paragraph which operates, respects and promotes the distinctiveness of the national and county levels of government. Unless the said EGP system, Honorable Speaker, rolls out circulars that are duly accompanied by regulations that are supposed to be scrutinized by the Committee on Delegated Legislation, then the said will be void ab initio, Honorable Speaker. Finally, Honorable Speaker, Section 77(1)(c) of Public Procurement and Asset Disposal Act provides, Honorable Speaker, that submission of tender documents, provides that submission of tender documents, whether in electronic or manual form, shall be in writing, signed, and in the case of manual submission, they shall be sealed in an envelope, Honorable Speaker. Therefore, Honorable Speaker, the law as it currently stands provides for both. It provides for manual and electronic. This is the issue, Honorable Speaker, that when the Cabinet Secretary appeared before us, was what we informed him, that it was the foundation. Honorable Speaker, it's good to make it clear that the Cabinet Secretary said in his own words, and I quote, that the government thinks it is losing money when it uses manual system. And Honorable Speaker, my submission to him then, and I put it to you now, that it doesn't matter what the government thinks. Because if we were to allow the government to think and ignore what the law provides, then that would allow the government to do anything contrary to the law. The law is very clear that both of these provisions, Honorable Speaker, that both manual and electronic is what is recognized, Honorable Speaker. Honorable Speaker, if we don't deal with this issue, the issues of procurement, government is the largest consumer. Right now, government is not consuming these services. It means all those business people out there are not paying taxes. And Honorable Speaker, in the long run, we're actually not going to have anybody, we're not going to meet our tax targets for the first 2 quarters, Honorable Speaker. So therefore, Honorable Speaker, I think the Cabinet Secretary cannot, it's clear that he cannot rely on an electronic system alone, and if he intends to move us in that direction, he must bring an amendment under Section 77(1) of the Act. Honorable Speaker, with that, I beg to move this, to second this motion. Thank you.
Very well, honorable members. I now propose the question, which is that further to the resolution of the House on the 19th August 2025, regarding the nullification of Circular number 4 of 2025 on enforcement of compliance with the mandatory use of electronic government procurement system, EGPS, and pursuant to provisions of Standing Order number 209 in brackets 2, this House adopts the 4th report of the Select Committee on Implementation on the implementation status of the report of the Committee on Delegated Legislation on its consideration of Public Procurement Regulatory Authority Circular number 4 of 2025 laid on the table of the House on Tuesday, 14th October 2025, and further nullifies 1. Circular reference number NT/PPD/1/3/14, volume 6, dated 26th March 2025 by the Cabinet Secretary, the National Treasury, and the Economic Planning, directing the accounting officers to transition to the EGP system with effects from 1st July 2025. And 2, circular number OP/CAB6/2A, dated on 5th June 2025 from the head of the public service, reiterating the need for all procurement entities to onboard onto the EGP system, which occasioned the issuance of circular number 04 of 2025. Yes, the first bite goes to the Honorable Ngogoyo.
Thank you, Mr. Speaker. Mr. Speaker, I rise to support the motion on the floor. One, because the executive and this, specifically the CS Treasury, does not have the role of imposing any circular on any government agency that is not in line with the act that has been approved by this House. The Public Procurement Act outlines clearly how procurement shall be done, in which manner, in which form, and worst of all is that today there are businessmen in the county governments, in the national government, who do not intend to do business this financial year, but because they have pending bills, they cannot be paid just because a county government has not been onboarded into the EGPS. You even deny people who have pending bills an opportunity to be paid. I've engaged with contractors, friends who have done business, supplied to county governments. They cannot be paid. Why? Every unit must be onboarded to EGPS so that the budget is uploaded. One, laws are about efficiency. What efficiency is the Cabinet Secretary bringing in by providing such a circular? He has denied all institutions ability to procure for simple things that are unavoidable. Today we have a crisis in Elgeyo Marakwet. There are goods that might be procured so that they may assist the people there. Emergency issues. You cannot do it. We as NGCDF, because of parts of the country, there was rain, you want to do maybe special units for children, you cannot do it. Just because somebody has written a circular, not referring to the mother law. One, the Constitution of Kenya, and number two, most importantly, the Public Procurement and Disposal Act. I therefore want to say that the Cabinet Secretary, who has even been a member of this House, I wonder why he chooses to do such circulars. And lastly, let me say, Mr. Speaker, we have denied Kenyans an opportunity to trade with their governments, both county and national government. 6 months, no business. You force people into a training. You even plan, has this EGPS tried anywhere else? Which institution did they pilot with? They should have even picked one agency and tried so that they see whether it works. Actually, as one of the people who have dealt with this thing, it is not even working. In my sub-county, we do not have internet for the last 1.5 years. So it can't even work. The head of procurement there for any institution, TVETs, secondary schools, NGCDF, they cannot do any procurement there because there is no internet in Ngong sub-county district headquarters. And I want to say that it is actually very wrong to put all government, to expose government in the manner in which they have been exposed. And lastly, we must also say to the executive, they cannot bring such laws at such times. Why, when we are just, for instance, even in CDF, you have to exempt NGCDF financial year 24-25, and other agencies of government are not exempted. Why? Why is it haphazard? A law must be predictable, consistent, and it must be straight looking. You do not need to struggle with the law. Characteristic of a good law is that it is predictable. EGPS is not predictable. John Badi did not research. This is not the making of an institution of national treasury for the many years that we've known. And we want to say that we must reject it at all costs. Let us allow business people to trade with government with ease. Actually, why people grow in business is the ease of doing business. We need to make it easier for people to do business with our government. With those many remarks, I want to say I support that we do away with this law and make sure that we start procurement from tomorrow morning. From tomorrow morning, from midnight, let government agencies procure. And we will be very tough by anybody who will go against this law in this 13th Parliament. Thank you very much, Mr. Speaker.
Very well. The Honorable Wanami Wamboka.
Honorable Speaker, one, I hold the opinion that this House must be respected. And in the places where we have discussed issues here and passed them as a House, the executive ought to respect that. A lot of decisions have been made in this House, and you will find ministers talking about them casually, including the President. Honorable Speaker, the first issue, circular number 4, issued by the Treasury CS, is actually ultra-vires to the Constitution of Kenya. I think it is cap 227. It is against Public Procurement and Asset Disposal Act, Honorable Speaker. The law provides for 2 ways of procuring. One, electronic, and another one, manual. So if anyone, a minister, a president, a member of public, a president, a member of this House, wishes to change that, they must go through the necessary processes to change the law. And that can only happen in this House, Honorable Speaker. So what Honorable Mbadi is purporting to do is just not inconsistent with the laws of this country. What shocks us all is that Honorable Mbadi has been a member of this House. I don't know why he wants to do the kind of things he's doing. We will not allow, Honorable Speaker. And I just want to pray that once we pass this report, Honorable Speaker, it should be expressed that after that, Honorable Mbadi has to do away with those things. What he is introducing, the CS Treasury, Honorable Speaker, is also discriminatory. The government came up with the Agupo law to deal with affirmative action. The young people who are not able, who do not have the kind of finances, experience, money to compete with the experienced businessmen. That law came up. Many of these young men cannot raise the expectations of this EGPS. For EGPS to work, you need internet. For EGPS to work, you must have power. In my constituency, Honorable Speaker, I operate on less than 15% electricity coverage. So you are discriminating against 85% of my constituency. I lead a rural constituency, Honorable Speaker. My people will be disenfranchised in doing business with the government. That is not how it is supposed to be. A lot of them are young women. You either need a smartphone, you either need a laptop, you either need a computer, Honorable Speaker. How many of these people, that the people who came up with the law to ensure that there is affirmative action to take care of these people, how are you going to take care of them? Honorable Speaker, at some point, I was just thinking loudly, is it the strategy of government not to spend money? Because, Honorable Speaker, where a government does not spend money for even a week, it is billions. Is it a strategy, Honorable Mbadi? The country is broke. You are not telling us the truth. You want to hide behind this mischief of bringing circulars that cannot even bring meaning to anyone, so that the government cannot spend. That is wrong, Honorable Speaker. Money must circulate for the economy to be stable. It is now almost 6 months. We are halfway since we passed the budget here. Nothing has been done. Critical services are coming to a halt. Yesterday I was at the KMTC, Kenya Medical Training College. They cannot procure even for the simplest of things, Honorable Speaker. I was at the REREC. They gave out tenders. Those guys cannot procure. All institutions are coming to a halt. We have hospitals that need emergency services by way of the things they procure. They are not procuring, Honorable Speaker. It is leading to deaths just because a minister of government feels too important than the rest of us and wants to introduce a circular that hurt people. Honorable Speaker, we have the framers of the 2010 Constitution put Wanjiko, Nanjala, Chepkurui at the center of it. Public participation, Honorable Speaker. That for you to bring any law, and laws are about people, for you to bring any law that would therefore affect the people of Kenya in any way, you must ask them, Wanjiku, what do you think? Nanjala, what do you think? Chepkurui, what do you think? Public participation. This law has not been subjected to public participation. They want to introduce funny things through the back door. They want to score. Honorable Speaker, I'm a footballer just like you. They want to score with the hand, and they expect the referee to say it's a goal. Honorable Mbadi, we will stop you. The government, we will stop you. We must stop you. And indeed, we are going to support this report that it passes. Honorable Speaker, the government is doing a lot of injustices to this House. The issue that we were debating of Kera roads, Honorable Speaker. The rains have come. The rains are spoiling our roads. But then, instead of government increasing money for these roads, Honorable Speaker, rural roads, because they are not able to build all the tarmac roads that we need, they are reducing. Honorable Speaker, we are going to say no. We say no, we shall say no, and forever say no. This House has powers. This House has teeth. It is gonna bite, Honorable Speaker. I want to strongly support this report, Honorable Wanjala, and the team. You have done a good job. And I want to urge my colleagues, turn up in big numbers so that we make a statement to this government that does not listen to the representatives of the people. We were elected, Honorable Speaker. We represent people.
Order. Honorable Wamboka has a point of order.
Honorable Speaker, thank you for giving me this opportunity. I do want to cut him short, Mheshimiwa Wamboka, but is it right for him to say that this government which does not listen, and our government is the government that listens to the people and to the needs of the people, and we do what is required of us? So is it right for him to say that this government does not listen?
Order, Wamboka. Proceed. Because you have less time, proceed.
Yes, Honorable Speaker. You choose from which lenses to see these things. You can choose to observe from psychophancy lenses. That's up to you. You can choose to...
Honorable Wamboka, be moderated. Look, because now you want to stray and you are a very good contributor. You are now using a parliamentary language. Could you conclude?
I'm sorry, Honorable Speaker. Honorable Speaker, laws are about the people, and the people are saying no. We are the people's representatives. we were elected. We are the only people who can purport, who can say that we represent people. And therefore, Honorable Speaker, if we say no, a cabinet secretary is an appointee of the president. We have been elected by universal suffrage. So this House has powers, Honorable Speaker. And I want to beseech honorable members, whether whichever side you sit, kindly, this is bad, let's consider Kenya first. I support the report strongly by Honorable Raphael Sauti Bita Wanjana.
The Honorable Karoli Omondi.
Thank you very much, Honorable Speaker. Every so often in the history of this House, members come with proposals that serve against their own interests or the interests of the people they purport to represent.
What's your point of order, Honorable?
Mr. Speaker, there is no quorum in this House. And the debate that we have is very sensitive. So, Mr. Speaker, there is no quorum.
Very well. The Sergeant at Arms ring the quorum bell. No. Once the quorum bell is ringing, no member can exit the House. So please take your seat. Honorable, of course, it's only the whips who can go. And I know, Honorable Gongo, you are not a whip, so take your seat. But the whips are allowed. Honorable members, order, take your seats. There's an honorable member who is upstanding. Honorable members, members rose from his place on standing order number 35. On the issue of quorum, I did confirm that there was no quorum. We have had the quorum bell ring for 10 minutes, and I can still confirm that there's no quorum. And therefore, honorable members, let's be upstanding. Honorable members, and the time now being 8 p.m., this House stands adjourned until Thursday, 6th November 2025 at 2:30 p.m.